Good evening and welcome to Health Check. Tonight, we focus on the well-being of your baby or your child. We all know that having a newborn comes with joy and excitement, but at times it comes with concerns like how to take care of your newborn baby, feeding challenges, diaper rashes, and even how to protect them from other health concerns. To help us address all your questions regarding your little ones, we are joined by Dr. Imran Harris, who is a consultant pediatrician at Honeybee Clinic right in the city of Nairobi, helping us to explore this topic. You can start sending in your questions on our WhatsApp number 0708 222 323 or our SMS number 20933. That is 222 323. That's the right number to send in your questions right here at OpTV. Remember, we're also live on Facebook and YouTube at OpTV Kenya. And you can share this link with a parent, a first-time parent, a second-time or a third-time parent, or a parent who has a newborn and just needs to learn a thing or two about that. And we'll be glad to hear from you. My name is Grace Mutiso. Good evening and welcome again to Health Check. Allow me to bring to us Dr. Imran. Good evening, Dr.
Good evening. Nice to be here.
Well?
Yes, I am. Thank you. Thanks for having me.
Okay.
Yes.
So tell us a little bit about yourself and what you do.
All right. So I'm Imran. I'm a pediatrician consultant. I work at, I founded and directed the Honeybee Children's Clinic, which is in Nairobi. It's a one-year time clinic where we practice family-centered care. We see, sick children, wellness, developmental assessments, and a bit of counseling for some of the bigger ones as well. Yeah, so we do early referrals, and we just ensure quality of life for these little ones that come our way.
Okay, thank you. And today we're talking about a very important topic, especially for parents. It doesn't matter how many children you have,
Sure.
as we focus on common infant and newborn problems. So the first question I wanted to ask, at what time should a parent be worried that my child could be having a health issue?
Right. So we look at the way children and, as they're growing, we look at it from the time there's conception. When there's that excitement, the baby is just, it's been declared baby is in the mother's womb. So that's the time when you really need to look at how is this baby progressing? Are they gaining weight? Is mother gaining weight as well? Is she going for her antenatal clinics regularly? And, is there's good weight gain and in the ultrasounds that the baby is actually growing, moving, the heartbeat is accurate. So that already gives a sense of hope to parents that baby is doing well, once when they're in there. But then on follow-ups with their gynecology regularly, there's always that sign of, are you moving from one trimester to the other and taking your medications? Because initially it's very important for mothers to be on folic acid just to prevent any neurodevelopmental problems.
Yes.
And then towards the third trimester to start on a lot of calcium to build those bones and muscles so that the baby is ready to come out. So once baby's out, then obviously then the journey begins, because now they're going from environment which is different. Everything is ready, warm, they're getting their food, and when they're out, now they have to call out for their food, and now they're in an environment where there's a lot of germs and microorganisms and different temperatures which can't be regulated. So all of this affects a baby, and so that's where the parental role comes in. How do I take the role or responsibility of keeping my baby warm, ensuring that they're not getting sick, by ensuring they get vaccinated, you see? So all of this comes in that. Now, unfortunately, sometimes one of the things, go amiss, and you find babies are told by the doctor, you may not, as the expectations are, the baby's out, he or she cried, we're going home in a day or two.
Yes.
And then, oops, the doctor says, sorry, baby's not looking too well. There's a change in color, or a change in behavior, or baby's having a fever. And that begins now the worries, like, okay, what did we do wrong?
Yes.
Okay, so all of these are sort of what we call preventable problems. And we look at that as we talk about, preventing neonatal mortalities as part of our Sustainable Development Goals up to 2030. Yeah.
Okay.
Yes.
Yeah. as we get into that, you mentioned something that has struck me, which as mothers, because at that time majorly is the mother, you are told your baby, maybe the father is busy paying bills or wondering how to take care of the other children before they come in. You're told your baby has changed color, and that worries mothers. So what happens when you're told your baby has changed color, and what do those colors mean? Yeah.
That's a good question. So when a mother is told that, or probably by recognizing it herself, or by the physician or by the nurse carer or health care provider who is very close to the parent or the mother in the early days of the baby, we look at maybe 1 or 2 or 3 colors. We'll quickly go through. The first one is just basically, is the baby pale? Is the baby pale? Are they just looking whiter than normal? And that could be as a result of either delay, not allowing what we call delayed cord clamping, which really helps babies get a lot of more blood. Okay, so quick clamping is something that we are trying to avoid now. If the baby is stable, we allow at least a few more minutes for the baby to get a little bit more blood, and that really has shown that, in studies, that it actually improves and reduces anemia in small babies. The second one is, of course, the yellow color, and that's the one that really keeps or gives mothers, jitters.
A bad color.
Yeah, a bad color, yes. So it's usually first noticed in the eyes, and then then it starts going all over the skin. So what we usually are concerned about as practitioners is when was it first noticed? The earlier, like after delivery immediately, is usually not a very good sign. It could tell us that the baby either has an infection that has been ongoing, and that has increased stress in the baby and caused that yellowness. Or in a day or two, it could be physiological, because the baby is still trying to breastfeed, and maybe the breastfeed is just not as quick as possible. But and that dehydration can cause that, but eventually it needs to be investigated, because if it is too high, it can cause a little bit of damage to the brain, and that's something that we usually keep monitoring and managing in a hospital setup. And then, of course, there's the dusky blue color, which tells you there could be a congenital heart problem, but that's usually very rare. But it's always good to just keep pointing out if the tongue is usually very dark blue or purplish, means the baby's oxygenation hasn't really improved. Could be a problem in the heart.
Okay.
Yes.
So those 3 colors,
Those 3
either
colors.
pale, yellow, or blue.
Blue, correct.
Okay, it's important. Hope you're learning, dear parents. And of course, if you have any question, engage with us. Our WhatsApp line is 0708 222 323. Please send in your questions right now, because our focus today is just to help you answer any question you have regarding your child's health right here. And I have Dr. Imran. He's a consultant pediatrician with us right here on Health Check. So a baby has been born by God's grace, no yellow, no blue, no pale. Baby is fine.
Correct.
The next question is, this baby just can't feed. Or I don't have milk as the mother, and you're still in the hospital, and it gives the mother stress, and of course gives the baby stress.
Correct.
So talk about that.
That's a very, very important question, and faced quite by a lot of mothers at that point of time. So as practitioners, we also encourage early latching of the baby as soon as baby is born. Okay, so usually when the baby is just born, they have an instinct, okay, a godly instinct to actually, if the baby is actually put on mother's abdomen, they're actually able to move up by instinct towards the breast and actually hold on to the breast and suckle.
Yeah.
And just that initial latching, because before the baby goes into a deep sleep, will actually initiate the process of let down of where milk can actually start being formed, and the breast buds get active, and there's that neurological signal as well. However, if it's delayed, that then delays the process. When baby wakes up now after the deep sleep, they're hungry. They really, their sugars are really low, and that's quite dangerous. So they cry. They're calling out for that milk, and that becomes a little bit tricky. So we really encourage early latching if the baby is stable. A stable baby is a baby who comes out crying, is active, the tone and muscle is good, the color is pink, that's a good color, pink is a good color.
Yes.
So you want to immediately latch. It doesn't have to be for, too long. It's just to initiate the process. And the baby may not get milk, but it's just to create that connection and that bond. And that really even helps the uterus contract early and the baby to start initiating breastfeeding early.
Okay.
Yes.
A mother who's going through CS might wonder, how is that done? Because maybe you're half awake, being operated on. Yes, you've had the baby crying, and is it allowed to still have the baby there?
Correct, it is. As long as there's a good communication between the receiving physician or healthcare provider and the one performing the cesarean, that we encourage delayed cord clamping if this baby is crying, so that the baby can get enough blood, vis-a-vis don't get dehydrated, vis-a-vis is able to be placed in a way that mothers can still breastfeed, because the stomach and the breast is a bit of a distance, and there's always a chance to do that.
Yes.
So it's in the West we see that a lot, and we need to continue opening up that conversation with our gynecologists to allow that early latch. And then but if of course if there's a complication, or if the mother is unstable, that won't go as planned.
Okay. And you've mentioned it's important that the baby cries when they are born. Help us, why is that really important?
Correct. So a baby cries when they're coming out from a different environment to a warm environment to a cold environment. So that stimulus tells us that the brain development and function is working, and the baby is taking their first breath. And that first breath is very important because it helps to push out a lot of the fluid out of the lungs and allow this baby's lungs to actually fill with air, because they're actually filled with fluid. So yes, so if a baby comes out naturally to the the vagina in that way, in that fashion, they squeeze out all that water out as they come through, and so it's easier for them to breathe. However, we see that even term babies or even preterm babies who are born through CS, because they haven't gone through that stress, they haven't gone through that process of squeezing out the water in their lungs, which are fluid filled, as natural as it is. Now they struggle to breathe. They struggle to breathe when they come out. Some of them, it's pretty okay, but sometimes you need to sort of resuscitate them, give them some air to push out those fluid out of the lungs, and then give them their first cry. So that first cry is very, very key, to know that the airway is clear and they're able to breathe their first breath and continue surviving in this new environment of theirs. Yes.
Okay. Now I know many mothers, so why is it important for the baby to cry? See, the baby is well, the eyes are up, so it's okay. So thank you for that. So another question that really worries first-time parents when it comes to infants and their newborns is the vomiting and reflux. Yeah. Let's talk about that.
Okay. So let's talk about the first 3 months.
Yes.
The first 3 months, the baby's stomach is the size of a strawberry. Okay, and it keeps very tiny, and so the baby doesn't really need a lot of milk. Mothers sometimes who are expressing say, oh, I'm not getting the 100, 200 I've seen on TV or Facebook and all of that, and I tell them no, it's quite normal. Babies start, their stomach increases as they're developing and growing, and they're growing the fastest in their first 6 months. So allow the baby to demand food as they grow. Around 1 month and 2 weeks, and this is a very, very tricky month, the baby's feeding, but then suddenly the baby starts feeding very aggressively. Okay, so mothers start doubting themselves and saying, hey, is it that I don't have enough milk? Why is baby staying on my breast for too long? Am I doing the wrong thing? And so there'll be a quick switch from breastfeeding to another extra source of nutrition, which are the formulas and other sort of things which are not correct. So at that point, it's important to know that the baby's brain is sort of communicating to the body and saying that we need to grow. That's something we call a growth spurt.
Yes.
And that happens occasionally in different times of the baby. So all it means is that there's a higher demand, and so when there's a high demand and you keep latching, there will also be a demand supply curve, which means that the supply will also increase.
Increase.
You just have to have a positive mind, drink lots of fluids and not milk, lots of fluids, get lots of rest, okay, and just keep bonding with baby, do a lot of skin to skin, and just have a positive mind, and you'll get that milk. Yes.
So that's a tip to the mothers, because
Correct.
there are so many theories, Dr. Imran. You have to take a lot of tea, without mentioning brands of the word.
Correct.
You have to take a lot of bone soup and a lot of uji and all that to help you get the breast milk. But I've had some moms who've done that, but still there is no breast milk, or others it's just a struggle to breastfeed. So is that possible? Or if we follow what you're telling us, positive minds, taking a lot of fluids, and relax and bond with the baby, milk will come?
I still believe that it does come, because even mothers who aren't the real mothers, maybe like surrogate or others, lactating mothers in the past, in historical past,
Yes.
and let's say something happened to the mother, you'd have mothers who just come and lactate naturally, even if they hadn't had the baby or that. So it's all about this hormonal cycle, that once there's a latch and there's a demand, the body responds and then starts creating that milk, okay? Now, when you mention about vomiting and reflux, usually the first 3 months, the valves that control the amount of milk are a bit weak. And so when babies are drinking very aggressively, especially during their growth spurts,
Yes.
a lot of that milk is going to sort of, because they can't control it, can't put brakes, so a lot of that milk would start coming out very fast. So you may have something we call a spillover, and that's normal. Okay, and what you need to do is differentiate it from vomiting, which is a bit more forceful. And when the vomiting are too many, then it's important to know that if the baby is not gaining weight, there's probably a chance that this child has early reflux. But if it is a lot of spillover or spit up, then it's important to sort of pause the feeding, because this baby is really aggressive, they can't stop,
Yes.
and their tummy is really stretching. So you want to take pauses, few pauses, like 2 to 5 minute pauses in between, to let one set of milk go down, take a walk with the baby, restart, so that there's less spillover, and ensure you burp the baby. Sometimes burping can be a bit of a challenge, and someone won't have that patience say, hey, I've done it for 2-3 minutes. So it's important to keep next to the chest, rub around the baby's back, and once in a while squeeze in. So when you squeeze in gently, you sort of bellow the stomach and allow a bit of that air to escape. And it doesn't have to be a perfect burp, but 1 or 2, and then you can just walk around for 5 minutes. If the baby is not burping again, you can then place the baby swaddle and put them to sleep.
Okay.
Yeah.
So the breaks in between and burping.
And burping, very important, yes.
Is there any other way you can burp the baby apart from this one up here, which you have to stay and patiently wait?
Correct, yeah. Yeah, so I mean, there are different positions. There's one that goes all the way up here. There's one that, I find the one here much better, because if the baby's up there, you don't know if they're spitting up, if they're vomiting, if they're sleeping. So you'll have to keep interrupting the baby to keep checking.
Yeah.
Yeah, so here it's a little bit more warmer, and you can sing to the baby, you can watch the baby. It also increases your breast milk, because the warmth, the bonding, we call it kangaroo mother care.
Yes,
Yeah.
yes.
So that warmth already, that stimulates a lot of the milk as well, and you're able to sort of give the baby warm back rubs. Ensure that when you're doing a back rub, that there are not too many clothes or too many layers. You need to at least have a gentle one layer that you're able to feel the baby's back, and don't be too aggressive. Just gentle, sing to the baby. Ensure that you stabilize the baby's head, maybe with your chin or with one finger, as you warm, 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 push, 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 and the baby will eventually burp.
Okay. Still on matters vomiting and reflux, is there a point that a parent should get worried to take this child to the hospital? Because you've mentioned you need to note between a spillover, but at what point does it cross that line? It's not longer spillover, there is an issue, and I need to take my child for a checkup to a pediatrician.
Yeah, that's a good question. So usually before mothers leave hospital, as a pediatrician, my role is to ensure that we have something called essential newborn care. Essential newborn care is just basically ensuring that they clean their cord, and any eye check, taking care of any eye discharge or infections. We talk about vaccinations before they leave the hospital, the BCG, polio, and hepatitis B. And then we give them danger signs. And one of the danger signs is basically what you mentioned, is vomiting. The other danger signs are fever, convulsions, irritability, the yellowness, the jaundice, you see, and refusal to feed or refusal to pass urine. Because passing urine is an indirect way of saying you're dehydrated and you're not getting enough milk. Okay, so that's very important.
Yes.
So if they're irritable and you've, in your mind, because the baby can only communicate by crying,
Yes.
so you should have a mental checklist and say, is the baby hungry? Is the baby, what do you say, dry, wet, dry, hot, cold, hot, wet, or has had a poop, right? Or, just want to be picked up. So if none of those are fitting in and you go into that checklist and baby is just incessantly crying and there's no fever or anything else, then it would be very important to have a healthcare provider check it to ensure that there's nothing else that's going on. It could be as simple as a diaper rash, or the baby has some sort of underlying infection that no one understands why, you see? Yeah.
Okay. When we were talking off air, Dr. Imran, you mentioned, the age from the time the baby is conceived to the time they're born, and 5 years is a critical age.
Correct.
To a child's life, and the mortality rate is not so good. I want us to talk about what are some of the things that mothers are not doing that is causing to the death of their children below the age of 5, and some of the things, because I know healthcare workers are also watching, that are not taking heed to, that is leading to the death of children under 5.
All right. So that's correct, actually. The recent National Demographic and Survey, which was released in January 2023, which is a survey that's done usually over at least every 7 years. What it showed is that our under 5 mortality has gone from about 52 to 41 per 1,000 deaths. Okay, which is a good improvement in the years that are there from 2003. But the neonatal mortality still remains very high. The neonatal mortality is still at 22 and 22 per 1,000. And for us, we need to improve that to about half, so about 11 or less than 12. Okay, and that is to our SDGs, which are up to 2030. So, correct. So what are we not doing right? So when it comes to under 5 mortality, how we've really improved those figures is by ensuring hygiene. Because majority of these, mortalities are actually preventable. These are not complex things. These are just essential care, hygiene. So after COVID, and a lot of that has been going on, we've seen a lot of sanitation, hygiene, and a lot of people are now focusing on healthcare matters more than before. And so when they noticed that vaccination was actually a big deal after COVID, they've actually been following up their vaccinations, you see. So I think that's one of the biggest factors that's relating to reduced mortality. But then we still get those missed opportunities as well. Like, for example, the recent rotavirus outbreak and a lot of deaths in one of our regions in the country. We actually had a lot of the rotavirus vaccine missing in the country for some time, and we saw the result of that a lot of children had missed opportunities, and they contracted the rotavirus, and it was quite deadly and quite sad. Yes. So that's one of the biggest contributors is vaccines and vaccine uptake as well. But again, we also look at nutrition. We've had an improvement, because I like to look at what good things we've done. There's a lot of improvement in nutrition. Malnutrition cases have actually reduced significantly. We don't see them as often as we used to, because there's always this awareness about malnutrition, and there's a lot of people taking up courses in nutrition or nutritional care, nutritional awareness. We still are having children with stunting. That's something that's still there, and it will still be something that will keep creeping up to us. But the earlier we improve nutrition, which starts, like I said, from preconception, conception, all the way through breastfeeding exclusively for 6 months, and all the way up to 2 years, with now, complementary feeding, and just sort of following up with your nutritionist, continuously doing your clinics will guide the healthcare provider to look at your growth. Is the baby's growth faltering? Is the baby's growth good? And not just, it's not just for coming and getting your vaccination and going. There's a lot of health talk that needs to be go through about nutrition. Why is the baby not growing well? Are they taking micronutrients like iron, you know, calcium, vitamin D? Vitamin D is a big factor for a lot of immune improvement as well nowadays. Yeah.
Okay, okay. Thank you for you watching us, and you have any question or comment, you know, talk to us at Top TV Kenya is where we are on Facebook and YouTube. We are live, by the way, and you're also getting your questions regarding your child's health. Our WhatsApp line is 0708 222 323. That is 0708 222 323. That's the platform you can use to forward in your question. And of course, Dr. Imran will be glad to answer you. Now, you mentioned about immunization.
Correct.
Very important bit of babies, 5, let's say 5 and below. So what are some of the vaccines that are a must for our babies, the infants?
I'd say all of them. Yeah, but it's important that you know, majority of the ones that they start off with, BCG, polio, and hepatitis B are usually the first ones they receive before leaving hospital.
Yes.
And then they should come at least after 2 weeks, just to see that baby's doing okay, that there are no concerns by the parents. You know, once that is checked, then they're told to come in a month's time, and then follow up at 6 weeks, 10 weeks, and 14 weeks with the basic and most important ones, which prevent a lot of things like pneumonia. So you have the pneumococcal vaccine, you have the rota vaccine, that is never understated, that is one of the most important vaccines that has helped really change the dynamics of mortalities in children due to diarrheal diseases. So that's so important. And then of course there's the ones for the 5-in-1, the pentavalent, where you know that protects them from a lot of pneumonias. We're seeing that a lot as well. That has reduced significantly. Pneumonias have really reduced due to that, those sort of interventions as well. And then following that, then there are some essential vaccines that can be found in some of the private facilities, like the flu vaccine, which is also very important at the 6th, 7th month. And then at the 9th month, then they get their measles vaccination as early as that. And then, yeah, so it follows that way, and then they keep getting their boosters throughout as they grow up. Yeah.
Okay.
Yes.
So is there an age that you'd say vaccines done? It's just boosters that a child needs to get?
Yeah, so really basically after 18 months, they are optional vaccines or essential optional vaccines, which, I mean, we do see children with these conditions, and these are preventable as well. Like you'll find hepatitis A. I've seen children in hospital contracting that. There's varicella. We have the meningitis vaccination. So all these are quite important. And of course, our 10-year-olds, we can't forget our young ladies, you know, to get the HPV vaccine, which is available as well at 0 and 6 months, which protects them from cervical cancer. Yes, and this is, I think, the Cancer Awareness Month. So I think it's very important to also not forget about our young ladies as well. Yeah.
Okay. And now a big question that especially the first-time moms or first-time parents, you know, you're told so many things around vaccine. You know, you should do this, not do this. And a common one that the parents keep asking, the baby-friendly vis-a-vis the non-baby friendly vaccine, and you're told the baby friendly, your child will sleep, there'll be no issues. Help us demystify that. What's the difference, and is one better than the other?
Yes. No, essentially there's no difference in the sense of what are you covering. You're essentially covering the same you know, infections and protecting children with the same. So there's no, you'd say one is more beneficial to the other. However, when it comes to things like pain, what you'll see is that the private, the essential, I would call them essentials for now, the ones that are given in private facilities are usually given, are individualized. So you won't get a batch, for example, you'll come on this day and you'll get all vaccines on that day only. So it helps to prevent missed opportunities, and then the patient comes and gets an individual vaccine per vaccine has their own syringe. So they tend to have less pain and less sleepless nights. But at the end of the day, as long as they get their vaccines, I would say both are important. The one comes free, the other one comes with a cost. So I think it really doesn't matter. What the main message is get vaccinated.
Yes.
And make sure that you have no missed opportunities. Keep looking at your booklet and just checking and seeing if there's anything that you could do extra for your children, because everything is an added advantage to their survival and to prevent some of these very life-threatening diseases. Yeah.
Okay. And if a parent missed, a vaccine, maybe the one that was to be taken at
Sure.
whichever month,
Yes.
is there hope for them? Can a child take? Maybe they're supposed to take at 9 or 6 months and they missed it.
Yes.
And now the child is 8 months. Can they take it at 8 months? What they were to take at 6 months?
Yes, I mean, it's very important to ensure that if you're taking a vaccination, that you ensure the boosters are given on time, because the boosters basically keep your immunity threshold or levels high up there.
Yeah.
If you miss your boosters, then the levels of antibodies will start declining over time. So that will be almost like a waste.
Yeah.
So it's important to ensure that those boosters are kept in time. Most of them are usually 6 months apart. So it's important to do that. The cholera vaccine usually is 2 weeks apart to a month apart. And if you miss that, then you don't get the 5-year protection. So these small things, information, you must listen to your practitioner and get. However, if you have a missed opportunity and let's say, for some reason or the other, you've delayed, get that vaccine as soon as possible.
Yeah.
As soon as possible. The rota vaccine can be given at least up to 12 months, according to the specialists. It can go even up to 12 months. So if you've missed it, just try and get it before the first year of life. After that, doesn't really help. Yeah. So it's important to get it at least the maximum is 8 to 12 months. Yeah.
Okay.
Yes.
So there is
for
hope.
rota. So there is hope. Yeah.
Okay.
So anytime you have an opportunity, go get your vaccinations, ensure you keep time with your boosters, and look out for the other essential ones as well.
Okay, thank you. We are talking about common infant and newborn problems regarding their health, and I'm hosting Dr. Imran Harris, a pediatrician and the director and founder of Honeybee Children's Clinic. Do you have any question when you come back after the break? We'll be tackling them. Engage with us at Hope TV Kenya on Facebook and YouTube. We are also on our WhatsApp line, which is so open. Looking forward to receiving your questions on 0708 222 323. That is 0708 222 323. My name is Grace Muti. So let's take a break. Get that glass of water, or if you're eating dinner, enjoy. Then we'll be right back with some more. When we come back, we'll be talking about colic. Keep it right here.
This week on Testify.
The reason why I'm not mentioning my family a lot in this story, not that they were not in the picture, they were going at a trying moment. I had just come from home and Dad was diagnosed with cancer, stage 4, and kidney failures. So he needed more medical attention. More medical attention than I was. So when all this happened, my families were totally confused.
Only on Hope TV. Look and live. Every Wednesday at 7:30 p.m. Spotlight.
Do you feel like they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking.
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi.
Question or comments, we are glad to talk to you. Our WhatsApp line is 0708222323. We'll be getting to them in a short while. I've received a few of them already here, so keep them coming. And I'm hosting Dr. Imran with us. He is a pediatrician and also director and founder of Honeybee Children's Clinic. So before we get to questions that are really coming in so fast,
yes, please.
promise to talk about colic.
Correct.
Giving mothers sleepless nights, and fathers too.
Sure, yes.
What is that?
So
and how can it be prevented?
Correct.
Yeah.
So congratulations, mom and dad, baby's here. And you know, you've heard about colic, you've read about it, you're almost prepared, but then you get to the nightmare and you just don't understand why this baby is screaming their head off, okay? So babies are basically communicating, and when they're crying, they probably are also in a bit of pain.
Yes.
So it's important to understand that as babies, and usually this is within the first 3 months. It gets easy after the first 3 months. So before the 3 months, things can get a bit tricky. So as babies feeding aggressively, sometimes they may take in a lot of air during that aggressive feeding or the growth spurt, which we mentioned.
Yes.
So during that taking of air, that air has to go somewhere. So basically it can really pile up and really cause a lot of gas in baby's tummy, a lot of spit up and a lot of discomfort.
Yeah.
Because babies are not moving like we can, so they tend to get to, turn a lot, twist a lot, just try to get that gas out. And you may find that their stool habits also change. If they've been, passing stool for at least 4 or 5 times a day, you may start seeing them having less of that and more of farting or, flatulence. And then sometimes with the flatulence, you get a bit of stool in the diaper. That's always an indicator that the baby is quite gassy. Yeah, and that could contribute to a lot of colic. Sometimes colic is just not to be understood, So what you just need to ensure is look at first mother's diet. Look at mother's diet. What are you eating? Because what you eat translates to what baby kind of gets as well, the milk, right? So ensure that you're not taking too much of gassy foods. I mean, I wouldn't mention them, but them eggs and beans. And I mean, do eat them. They're healthy, balanced diet. But if you're doing too much of something or excessive something, you may look back and say, whoops, my baby, I ate this today and baby really wasn't so happy over the night or something like that. So look at what you're eating. Ensure that you're not taking any cow milk. I've seen that taking a lot of cow milk, translates into baby taking that as well, and then they get really bloated, or they get either skin rash or dry skin or eczema as early as that, and also a lot of colic. So milk doesn't give more milk. I'd say just fluids, continue that.
Fluids is water, the
fluids, soups,
juices.
Yeah, fresh fruit juice, soups, your oats, and your sort of any hot chocolate which has malt. I won't give brands, but yeah, most of these ones, there are many in the market which have malt in them, yeah, and they really assist as well. But the most important thing is to ensure that you're eating healthy, that you're not eating those heavy foods. Now, once baby takes that and now they're gassy, let's say they've been latching aggressively, ensure that the latch is a quiet one. Ensure that you're not in pain. Ensure that the baby's lips are covering fully and sealing well so there's no air going in. Because once that air goes in, you'll have to get it out.
Yeah.
All right. So rather than getting it in, ensure your latch as well. Ensure baby feeds well, and then ensure you burp at least once or twice.
Yes.
Once baby's burp, he or she feels comfortable. And then, you can then, sometimes if they're awake, you can do a bit of tummy time. Tummy time helps them to just sort of, squeeze their tummy as they're sort of, holding up their neck. Because you want their neck control to also improve by 3 months.
Yes.
So tummy time is good when they're awake, not when they're asleep. And then massage. Massage is a huge, huge thing. Once your cord is off, you need to start massaging baby.
The stomach.
The stomach.
Or the entire body.
Entire body is good. It stimulates them, their blood flow, and makes them sleep much better and happier.
Yes.
But you need to also focus on that tummy a bit, not too aggressively, just gently, with a lot of cycle kicks and a lot of sort of pressure on the tummy, with stretches, and that sometimes helps to allow that gas to come out as flatulence and gives the baby somewhat relief. Because I really leave medicine to the last sort, yeah. And there's a lot of natural vis-a-vis medicinal products out there that help the baby calm down in terms of colic. But we first try doing natural methods first. Yeah.
Okay. Good. One more, fever. Oh, fevers, and they come whichever time. They don't give a warning, you know. And when is a baby considered to have fevers that should warrant a mother to rush this child to the hospital?
Okay. So I usually discuss fever to parents mostly, around 6 months, from 6 months onwards, because usually there's a time frame between 6 months to 6 years when babies are more prone to seizures, fever-related seizures with high fever between this age bracket, so 6 months to 6 years. So that's where I'm a little bit more concerned when it comes to fever. But I wouldn't advise parents to panic. Yeah? One of the best things is do not panic, because when you panic, you don't think straight and you can do other things as well. So fever is common, and fever is not a bad thing. It's actually just a good thing, because it says that the body's immune system is trying to kick in and fight, and as a result, you'll get this increase in temperature of the body. So it's what I'd advise is have a thermometer or two in case one breaks down, or for quality control.
Yeah.
Always good to have two thermometers, and then also to know what normal temperature is. I mean, you put it there and you stick it in there and you'll be like, well, it's 37.5 and the baby has a fever. Really, no. Normal temperature is 37 plus or minus 0.5. So we live within that 36.5 to 37.5. Anything below or above is not normal, right? So if you're looking at anything above 37.5, it could be low grade to high grade fever. It doesn't matter if it's 38, 39, 40, fever is a fever.
Yes.
So the first thing to do is do not panic. Yes.
Okay.
All right?
Relax.
Just relax. Yeah. So many things can cause fever. Pain can cause fever, and inflammation, like an ear inflammation, throat inflammation, can cause fever, and infection, which is a more common one that causes fever. And that's what we really look at when we're, assessing the baby in the clinic, is why is the fever, what's the pattern of the fever, how frequent is the fever, how often, things like that. But the important thing to do at home is first aid. And first aid for a baby when it comes to fever is, as we say, do not panic, undress the baby, at least up to the, the diaper. Do not on an AC or a fan, just sort of mop up the baby with warm water, distract the baby. Distraction is all in the mind, they say. Also helps the baby, sort of comfort them, don't panic, because they see your fear. The babies see your fear. So just smile, laugh at them, play with them, but at the same time just sort of mop them, because if you do aggressive mopping, they'll get scared as well, and they'll fear, and the fevers will just get worse. So just play with them, mop them quietly, sing to them a song, and then if that doesn't bring down fever, then you can then now do medicines as well.
By medicine lists, a mom does self-medication of the baby. Is that advisable? I can go over the counter and say, my baby has fever, it's 39.
Yes.
Give me something for the baby. Is that advisable? Or for children, they must see the pediatrician first to advise?
It's advisable to at least, if they've tried their first aid and the fever's really not coming down, and they're within that 6 month bracket to 6 years, you'd want to bring down that fever as soon as possible. And you, after mopping, undressing, if it's still not coming down, you can still, there's an option of doing paracetamol. Yes, at least as the first thing, right? And not anything else. And let the healthcare provider know. You don't necessarily have to go to a hospital. You can observe the baby. Look for other symptoms as well. Is the baby feeding? Are they passing urine? Are they irritable? Are there other, features of irritability? If it's just fever alone, but they're happy, they're playful, just observe, and note down the timings.
Yes.
For me, timings are very important.
Observe timings. In the village when I was growing up, when any of us had fever, we'd quickly get a piece of cloth with very cold water and
That's correct.
Is that okay? I've noticed you've said warm.
Warm, right? Yeah.
Yeah.
So cold, I mean, anything cold on you, you get really annoyed, number one. So I wouldn't advise that, yeah? It can scare the baby quite a bit. So you'd want warm, because warm has energy. Cold doesn't have energy. So when you put warm on hot, it evaporates faster, and it cools the body faster, right? So that's the outside temperature. Just like the earth is cold outside and the core is hot, or like an egg which is cold outside and hot inside, so is our body. There's a core temperature which is 1 or 2 degrees higher. So if you're at 39, you're probably 40, 41 inside. So the Panadol will work to bring down that core temperature as well. Yeah.
Okay, thank you. Last, not to get to your questions, our viewers right here. Remember, WhatsApp line 0708 222 323. That's the WhatsApp number. You can engage with us, and we're also live on Facebook and YouTube. Talk to us. A parent writes in and says, my baby was diagnosed with osteogenesis imperfecta, mild form. You'll forgive me for the jargons. You'll pronounce them well, Daktari. She is 1 year old. Has the doctor heard of this before, and what's its management? So maybe we could start by defining what's that.
So osteogenesis imperfecta is a sort of congenital problem where the bones the strength of the bones is not there, and these babies have a high chance of fractures. Yeah, so bone fractures, okay, because of the tensile strength. So unfortunately, there really isn't any cure for that. But what we just ensure, if it's a mild form for that matter, is ensure that the baby, doesn't, isn't prone to injuries, which is very hard because babies are on the move at all times. Yeah. So just sort of doing a lot of safety checks and ensuring that they take their basic nutrition as usual, their calcium, vitamin D, ensure that that's in check. But really something that nothing much more can be done. Yeah, just to ensure that they don't do anything that's injurious to them.
Okay. One more, talking about thrush.
Good.
The child has thrush. So is there a way to handle that? It's yet to clear.
So that's a very good question. We see a bit of thrush in babies who are just born. Maybe 2 weeks down the line when they come, parents visit the healthcare practitioner. So you find that in the lining of the mouth, you find this white, curdish, yogurt-like, particles, which really are adherent to the cheek, and they're not really coming out, even if tried to clean with a cloth or things like that. So that's usually a sign of thrush. Thrush is a fungal infection, and because the immune system is still developing and the body sort of tries to, try to fight it off, sometimes it's a little bit trickier. So for that, they need to come and see a healthcare practitioner or a pediatrician, because it can be painful for the suckling when these elements of fungal are on the tongue vis-a-vis on the cheeks, and suckling can be disrupted because of the pain involved in that. And usually the pediatrician will give some medication to eliminate that at the same time as well. But a good question. We see that a lot. However, if it persists, then that's sometimes a red flag to see why your immune system isn't picking up to eliminate that despite medicine and other things. Then you need to rule out other immunodeficiency conditions, which,
Is there a time frame where I would say, this has persisted so much, I need to see?
That's a good question. It's hard to say, but they won't be just that. If you're immune deficient, which could be either primary or acquired. Acquired is like HIV and other, sort of if you have like cancer treatment, and that really brings down your immunity, or if you're on steroids. So that's usually acquired. But if it's primary, it means that your body just can't surmount an infection because the cells which fight those infections are either not being made, or if they're made, their quality is not so good. So you look at other things, not only just thrush. Maybe the child will get sick too often. They'll be admitted for pneumonia too often. There'll be recurrent infections, not only internally, but also outside. You'll see a lot of boils, a lot of skin infections, and, which is not common in children. It's because the immune system can't really hold out these bacteria, and you'll be on antibiotics for too long. Yeah, so that one really needs to be really checked by a pediatrician as soon as possible.
Okay.
Thank you for that. Yeah.
Thank you. Davis from Nairobi, hi, and thank you for writing in. Davis is asking, which is the best sleeping position for a baby to avoid choking?
So That's a very good question, Davis. Babies before 3 months who have still not got head control, it's very important to ensure that you avoid co-sleeping as much as possible, so that you prevent something called SIDS, right? And you don't want to sleep on the baby or lie on the baby. How many times have we slept and you find, oh, my phone is under my leg,
Yes.
You're so tired because the baby's been keeping you up all night. So it's very important to keep the baby, either have some sort of barrier, or put the baby in a cot, which is just adjacent to your bed, and remove one part. So it's just adjacent to your bed, you feed and burp and return. But when you're returning and you're putting baby back to sleep, very important is to swaddle them. They find it very comfortable to feed and sleep as well. When they swaddle, or if they're just sleeping without the swaddle, important to lie on their back, always on their back with the head on the side. So never the baby in a left sideway position, always on the back, and then you can shift the head left and right so that they don't get a flat head, so you just move it right and left like that. So that in case there's any spillover, it can flow out easily. If their head is looking upwards, it's possible that they can actually choke, because the milk would just go backwards and that sort of a thing. So very important to keep having a look at them and turning their head like that.
What if a parent does that but the baby keeps coming, looking straight or sleeping on their tummy?
Sleeping on the tummy is not recommended, especially in the first 3 months, because the baby can't turn their head very well. So they're at risk of choking on that, because they can't really shift and that. But after 3 months, we still don't advise, because there's still a chance of that. But if the parent is with the child at the same place and they're not leaving, then that's sometimes occasionally okay, as long as they're monitoring and observing the baby is not, they're lying on the side as well. But we avoid that as much as possible.
Okay. Our viewer asking on behalf of a friend that says, my family friend was pressurizing the daughter to cut the small tongue. This thing.
The kilimi.
Kilimi. Daktari, kilimi, that one.
Yeah.
Of her 2-month-old baby.
2 months.
To have it cut. As an older who had brought up several kids, I advise her not to cut. Can the doctor comment on that, cutting the kilimi in children?
Is
that advisable?
It's not advisable. That's a very traditional practiced by many and different cultures and different parts of this country. ENTs and other practitioners say no, because there's no relationship to that and coughing.
Yes.
And we'll get to that, because usually when we manage cough, they always sort of tally that the reason behind this child coughing is actually this vestigial, or what you call unwanted organ.
Yes.
But really, it has no role in your body, and it has no role in bringing about the cough.
Yes.
Yes.
Okay. One more, this one says, I just received my baby 2 weeks ago, and congratulations, dear mom, for the new baby. I'm not sure if I got hepatitis or rotavirus vaccine. Should I be worried, and where can I get it?
All right. So your hepatitis B vaccine is usually given at 6 weeks, 10 weeks, and 14 weeks. Very important is to get it at birth, especially if a mother has hepatitis B. Yeah, then it's something that should be given as soon as the baby is born. Rotavirus should be given at the 6 weeks, 10 weeks, 14 weeks, and if they haven't received, kindly do that and get it from your nearest facility before 8 or 12 months of age. Yeah.
Okay. And they can get it in any hospital,
Correct, yes, any hospital and every hospital.
Okay. So please ask Daktari to talk about stretching in infants. Some of those stretches are just scary. I'm wondering which is those.
Correct, yeah. So yeah, when we mentioned massaging at some point, right?
Yes.
And I think it's very important to massage, but do it very passively.
Yes.
Don't do it aggressively. Allow the baby's tone and movements to guide you through the process. So if they reach a limit where they can't go more than that, let it be. Relax, let it go. You'll find that babies usually even curl their hands a bit.
Yes.
You want to uncurl them a little bit, and you sort of press on their hands, sort of open up their hands. They don't really like that, but with time, they'll slowly start opening their hands and slowly sucking their hands at 3 months.
Yes.
So this is very important. So just avoid doing something that is causing harm to the baby, and the baby will react. A baby who is in pain or due to a painful, stimulus or painful stretching will have their eyes furrowed and their eyes wincing, and they're not looking very happy. Their mouth is, open wide. They're flaring in their nose. Know that you are causing pain to this baby. Stop immediately, or stop the person who's doing that and say, no, thank you. This is not helping the baby at all. This is causing more pain. Most of the time when you're massaging a baby, the baby should be smiling and happy, and they're enjoying the process. Yes.
Okay. Don't do it the way you are doing it to your older
Yeah.
human
beings. Yes.
And kanda kabisa.
Kanda kabisa, no.
Finya kabisa. Okay. Please talk about 6 weeks injection. Is it wise to get painkillers for the children after the 6 weeks injection?
Parents do that a lot, and I hear that a lot. I guess it depends on if the baby is having a bit of fever, a bit of irritability, and if you try and give paracetamol, and I would say that only because we avoid using medicines before 3 months as much as possible. But if it tends to calm the baby and give them some relief, that's okay. A massage can also do the same thing, and a nice shower with maybe a bit of lavender, something like that, and just skin to skin, breastfeeding. All these are medicinal. In fact, in our practice, before a painful procedure, we don't give paracetamol. We actually say breastfeed during the procedure and breastfeed after. Yeah. So that will be able to actually reduce 90% of the pain that baby goes through. Yeah.
Wow.
Yeah.
The power of breastfeeding.
The power of breastfeeding.
Okay. Then my child's hands and feet get very cold, really cold quickly. Is there a problem with that? That is Joy from Nairobi asking.
How old is the child? Okay, well,
she hasn't
mentioned the child's age. Okay, so babies are different. I would say that you'd find some babies during a fever they will be only hot in their head, but their hands and feet are really cold. Some babies just have different temperatures in different parts of the body. What I say is that before 6 months, before you start weaning, a baby is born with something called brown fat. Okay, this is something they're born with. They don't have the fat we do because they haven't started feeding as well, right? So all they have is these reserves of brown fat, which are different from white fat, means they burn fast, but they give the baby a little bit of energy. And remember, baby is still learning how to thermoregulate or control their body temperature, so they can't shudder or shiver if they're feeling cold. That's why we have to cover them. Okay, so basically, that is one of the most important things about the same. Yeah.
Yes.
Yeah. Your question was, just repeat the question again. Sorry.
The question from this parent was their hands and feet gets really cold quickly.
Correct. Yeah. So part of the thermoregulation is if you're cold, you're going to conserve the heat, and you're going to ensure that the blood flow goes to the main organs, which is your brain and your liver and kidneys, right? So the body then kind of transfers the blood to these areas. So sometimes you find the head is a little bit harder and the hands are a little bit cold, but that's all a way of controlling that temperature, so you're not losing a lot of temperature, you're not getting something we call hypothermia.
Yeah.
Yeah. So very important is to ensure that check the temperature. If the baby's temperature is below 36.5, remember we said normal temperature is 36.5 to 37.5. Yes. Then if they're lower than that, what we call hypothermia, that's a little bit dangerous. Okay, that can cause you to have low heart rate. So you need to quickly immerse this baby in warm water, or skin to skin if they're baby to baby on your skin. Breastfeed skin to skin, wrap in sort of clothes and blankets until the baby's temperature comes back to normal. So that could be also a sign of sickness or illness. So it's just good to just keep a check on that and talk to your pediatrician early about that.
Okay. Finally, as we wrap it up, Daktari, a parent asking here, what are some of those foods that as moms we eat in our diet that causes colic? We want to avoid them as much as possible to have a good night's sleep. Somehow this colic comes at night. I don't know why.
Yes.
During the day, the babies are just cool, calm. At night, so what are some of these foods?
So babies, so before 3 months, babies still are learning the day, night, and night settings, their chronological timings.
Yes.
When your baby kicked, when did your baby kick, Grace?
In terms of what?
Like when they were in the womb, what time did they kick mostly? Was it in the morning, the night?
At night.
At night, right?
Yeah.
Yeah, so when they come out into the world, they will wake up the same sort of times as then when they were really kicking. So until they get to their normal state, they're going to be really waking up at those times. Now, some of the foods, like I say, you must eat a well-balanced diet.
Yes.
And anytime you eat those extreme amounts of food, and we mentioned like a lot of, like for example, a lot of protein or a lot of foods that cause a lot of gas, you know, and I've seen in my experience, you know, when parents are eating too much, maybe for example, eating too many eggs a day, or for example, too much cabbage, or, you know, red beans, those foods cause a lot of gas, and sometimes translated, and milk.
Yeah.
Let's not
Cow's
forget
milk.
cow's milk, packet milk. If they're taking a lot of that, that's really going to bring out a lot of discomfort in baby. Yeah. So have them, but have them at a minimal level, a tolerable level. Milk, cow milk, no, I wouldn't advise that.
Okay.
Yeah.
And thank you, as we are just saying, thank you, Daktari, for the powerful session. It was a great moment of learning. I will apply when I get my second born. Thank you. That's the spirit.
Yeah. All the best.
Thank you, Dr. Imran.
Yes.
We have to call it a day right there. Your parting shot to parents, what would that be in a minute?
So let's do the right thing. Let's seek healthcare early. Let's make sure we do all our vaccinations in time, on time, and I wouldn't advise you to read too much on Google. I think a lot of parents are over-reading Google. Dr. Google, avoid that. Read the right information from right sources, and you can always ask your health practitioner, what can I read, or what should I read? And that always guides them, because sometimes over-reading some of these things can really cause a lot of unnecessary panic and make parents do a lot of things that are really not correct. Yes.
Thank you, Dr. Imran. Really appreciate you for coming. I believe as parents, we've learned a lot this day as we are talking about a common infant and newborn problems. So look forward to hosting you again.
Do appreciate, and thanks for hosting me.
Karibu.
Take care.
Okay. That's all we had for you on Health Check today. I hope you have learned a thing or two on how to handle your newborn. And if you have any question, please, it's good to see a doctor. If you have any concern, please see a doctor. Don't doubt those small signals you get in your heart as a mom or a dad, and assume they'll be fine, please. After doing the first aid, it's not working, take your child for a checkup. My name is Grace Mutisa. I wish you a blessed night. God willing, let's do this again next week on Tuesday, same time, same station. Of course, a different doctor helping us tackle an issue regarding your health. Catch a repeat of this tomorrow, right here at Top TV, and also during the weekend. Should be on Saturday around there. And anytime you're live on Facebook and YouTube. Have a beautiful, beautiful time. Shalom. God bless. See you next time. Bye-bye for now.